the Soapboxx. But like I said, he is also unvaccinated. TJ, welcome to the show.
Thank you, Duane. Thank you for having me.
Thank you for your bravery by coming on my show and taking these tough questions from me. But this is
if I can give them, I can take them.
Okay, you got it, my brother. Well, TJ, let's talk now. Why?
Mm-hmm.
Why is it that, first of all, you didn't get vaccinated with the first wave of vaccines when it came out? Why?
Well, I believe that, and I just want to start off by saying I commend anyone who has been vaccinated. I don't classify myself as an anti-vaxxer at all. I believe that if you want to be vaccinated, I believe it's a personal decision. And if you do so, you're making the right decision for you, your body, and your family. However, for me, I wanted to wait because as we've seen studies with Dr. Casper in the University of Illinois, he said that this pandemic, the virus actually can mutate. And so it's forever changing. And so I decided, you know what, I'm not going to say I'm never going to get vaccinated. However, I'm going to wait until I see the side effects, not just in family or friends, but see how the trends, how they are projected moving forward.
And so you decided to wait and see on those trends, but were you at all just fearful or worried or concerned about your health?
No, well, of course, you're always concerned about your health, and I think health and wellness should be everyone's top priority. For me, I've actually consulted with my primary care physician. I've actually reversed my diabetes within the year of the pandemic. So I've been the healthiest I've been in years. I've actually taken the preemptive measures by testing for whether or not I have COVID, which I do not. I'm fortunate enough to be remote, so I'm quarantined regularly, and I've always sanitized and continued to mask in large crowds, or whether I'm in resident or a business area. So I've followed those guidelines, the initial guidelines of the CDC and those experts, that were talking about the virus. But as far as the vaccine, it was something that I was hesitant to do for a multitude of reasons.
And you said hesitant, so that's what I want to get to, because a lot of people have been hesitant, and that's why a lot of people haven't gotten vaccinated. I do know people who have decided not to get vaccinated. A lot of people go to the Tuskegee experiment, and they go to the history, especially involving Black folks. Tell me about what you were hesitant about, some of the things that kind of made you think, well, I think I'm gonna hold off.
Well, initially they said the report was for the Yes. Hey, welcome to the Soapboxx Podcast. I am your host, TJ Legacy. And of course, I'm joined with the gang here. We have all the way from NYC, my man, Alan York. What's good, man? How you doing?
Listen, man, if y'all are listening live in effect, you know what time it is. But if you're not, it's draft time. We're literally live. We're broadcasting live during the draft. I got my Orlando Magic hat on. I got my New York Knicks spirit. So, I'm just excited about tonight, man. And so I'm feeling good. Man. How you feeling?
You got your rosary beads and everything.
Listen, I'm feeling so good. I don't even think it's going to take a Hail Mary and a prayer for us to have a good night.
Well, Lord. All right. Hey, listen, I'm going to go ahead and introduce all the way from Tallahassee, Florida. What's going on? Just Giovanni, just doing her. Just Giovanni, how you doing?
How you doing? Y'all already know what it is. It's your girl, Just Giovanni, all the way from the Tallahassee area. Right now, I'm trying to lock my son's hair up. So any mommies out there who have some advice, shoot me a DM. Huh?
He's getting dreads?
Yes, he is going to have dreads. He started off with some smaller locks, but they unraveled because his hair is short. So I am retwisting them now as we speak. Word.
Shout out to the king. And yes, as you guys see, this is 3/4 of the Soapboxx Podcast host. We are missing one. We just want to wish Just Say was not feeling well. But we are fortunate enough to have a roster of folks that are, love to be guest contributors, guest hosts. And you've seen this person on So Please Understand, her YouTube channel. Also, she's in the HR field. And you've also seen her on our spinoffs where we do movie reviews on Soapboxx Nation with Bad Tie, and myself. Ladies and gentlemen, please welcome officially on the Soapboxx Podcast, Holly Noon. What's going on, Holly?
Hey, everybody. Listen, I'm happy to be here. So excited.
Hey, Holly.
Listen, Alan, Giovanni, I don't know. There's been a lot of strings. I had to talk to Holly's agent. Like, it's just, she's a very important person, as y'all can see by the degrees on the back of the wall. So to get Holly to come in and fill in, no, we appreciate you, Holly, filling in, last minute, actually.
I know.
Not being, just not being there. It was the midnight hour. I was like, hey, can you? And she was like, sure. She was of course, shout out to Bad Tie. Shout out to Lisa. Thank y'all for tuning in. And of course, those in Soapboxx Nation, make sure you follow us. Soapboxx Nation with 2X. Soapboxx with 2X. Thank you for following us, from our fans all the way here domestically, and those who are watching us overseas, Portugal, Ireland, UK. You know who you are. So we definitely appreciate you tuning into the Soapboxx Podcast. That's I said the wall. Yes, the wall of accolades. Shout out to Holly New. But Holly, before we get started with today's topic, and we're gonna, for those who have seen the description of this podcast, we're gonna be talking to medical professionals about COVID-19, the vaccines, whether you're vaccinated, not vaccinated. But Holly, tell us a little bit about yourself. You're in the HR field, plus you have your own YouTube channel. What made you start your own YouTube channel?
So basically, I wrote a book. So I'm an author of a book. It's not about you. So please understand, a social textbook to understanding concepts related to people of color and racism. And so the main theme of that book is, so please understand. And so that's kind of where the name comes from. And so for me, on my platform, I'm really big on sharing stories that sometimes are just not told, aren't represented. And so on my platform, you'll see things where I talk about the Gullah Geechee culture. I talk about representation, like I have a Black pilot on my channel, Black entrepreneurs, things about music and culture. So I really try to hopefully, educate the next generation that there are possibilities, and you can be pretty much anything.
Word. I like that. And you had some, Alan, she had some hip hop aficionados on there too. Who did you have that was integrated in the world of hip hop? Do you know them off the top of your head? I know I put it on your
yeah. So I had Jay Flex. So he was a ghostwriter for Dr. Dre, and he was a artist on Death Row. And then I had I recently did an interview with Glenn Towery, and he's worked with like Bootsy Collins and Earth, Wind & Fire and some other artists in the R&B, soul, funk kind of space. And so yes, trying to tell some good stories there.
Word. And so you are also 1/3 of the host of Soapboxx Nation, where we do movie reviews. And if you guys don't know, Holly's got these facial expressions. She wears her emotions on her sleeve. So it's good reaction. It's great content and reaction videos. So we definitely appreciate everything that you do and contributing to the Soapboxx. But Alan, Giovanni, I don't know, the first story we got, have y'all been hearing about Miss Simone Biles, right? So Simone Biles, she is the GOAT, the greatest gymnast of all time in American history. She actually decided that, hey, for her mental health state, that she withdrew from the Tokyo Olympics. And when she withdrew, it was a huge uproar or fake outrage, as I like to say, of people talking about, hey, we don't want to, you quit on the country. How dare you represent? And you're not representing the country. I just wanted to go around the horn. I'll start with you, Alan. What was your first initial reaction when you saw Simone Biles withdraw from the Olympics? And do you think she made the right decision based upon her mental health?
Yeah, I mean, the first The first thing I saw was just breaking news. Simone is withdrawn from the Olympics. There was like a little bit of period of time in which there wasn't a lot of information that was being held, or should I say issued. But once they said it wasn't physical, then I kind of automatically knew what it was. I couldn't necessarily say, as much as I guess due to the stage, it was only a little bit of a shock, just because, essentially, and this is no disrespect to certain athletes in certain Olympic sports, but a lot of times, essentially, their only and biggest reward happens during Olympics. It's not necessarily like basketball, where there is a national championship that the majority of the sports fans are looking forward to on a yearly basis. So this is kind of their bread and butter. But that being said, the bigger the reward, the bigger the burden, right? So I would never be able to tell her that she didn't make the right decision. If she knows that she is not able to perform at her highest level, or she feels as if performing so would jeopardize herself even more, then I would never say that she made the incorrect decision. At the end of the day, it's crazy because she's so young, but she's accomplished so much in that field that she can never step on the mat again, and she'll be solidified as, if not one of the greatest of all time. So when you do have that rope to play with, then it's a little bit less damning when it comes to career-wise. So, and we are seeing this happen as well. We just saw with Naomi not too long ago, who bowed down because of her mental health, bowed out, I should say. And, the bigger the stage becomes due to the internet, the louder the voices become as well. And as much as we can say that those voices don't necessarily matter, or however much you want to call yourself locked in, there's only but so much that you can take. So, like I said, I definitely trust Simone with Simone's mental health, and I hope she gets well soon. And, I do appreciate her for just kind of making a stand for herself. Sometimes you do have to be selfish. And like she said, I mean, if these things could negatively impact her team. So if she doesn't feel like she'll be able to perform at the end of the day, is almost more so selfless than selfish to back away, because she doesn't want to hurt the rest of her teammates. So, I definitely respect her for that. And, we always going to have her back. So shout out to Simone. And, if she can release just some sort of a video of how she's getting those 6-pack abs, I would be very interested, because I'm trying to get myself together. And if, Simone, send me in the DM, just give me like a couple circuits, and we're gonna get these apps.
You see how men are. She's talking about she's withdrawing to focus on her goddamn for her mental health, and here you talk about I want to know how to get them abs and slide in the DM. Come on.
But no. But what's better? What's better than someone's mental health than a good workout, right?
Yes, drink some water for the thirst. Giovanni, real quick. Giovanni, look, we had Shakira Richardson, where she felt like she was where she had to withdraw, or she was disqualified from the Olympics. You have Naomi Osaka, who withdrew from tennis tournaments because of mental health. You're all about self-love. What do you think what would your message be to Simone Biles when it comes to, her mental health and how to handle the criticism of really choosing yourself? Because I know you're all on about that.
Yeah, I was elated or relieved. I felt like it was one of those things that had to be done for our culture to really start to grasp, like, it's okay to not be okay. And it's okay to announce or allow people to see that you are not okay, so that you have the ability to choose yourself, which we don't do enough. And I mean, if we just talk about being Black in general, like, and being a Black woman at that, we're already automatically seen as mean and angry. Sometimes we've been described as old, like we look old because we're always so tired. And so it's just like I feel like, this generation is not having it no more. I'm sitting out because I can, because it's my right. I still have my talents. They're mine. Nobody owns me. I own myself. And whatever it is that she has to deal with, it's personal to her, and nobody else can take it personal towards them. Although a lot of people, of course, in any situation, we are going to take it personally because, like Alan was saying, this is the once in a lifetime. I mean, it's not like it's every year or it's an NBA All-Star game. And so we won't be seeing Simone for another 4 years if she makes it back to the Olympics. But it's so necessary, and I really wish that the world could be more acceptable to it, or understanding of just like, hey, I'm a human being, and it's hard sometimes being a human being, especially when you're trying to figure out yourself and you're trying to figure out, like, is it okay for me to be this? Is it okay for me to actually be having these feelings right now? Like, what does this even mean? What does sadness really look like? Hey, I'm angry. Why should I be angry? I have all this money. I've accomplished all these different things. Like, where are these feelings coming from? And sometimes a lot of people feel like their feelings are not valid because it's not a life or death situation. But internally, it could be a life or death situation. And I always like to say that one thing when people say, just because well, not even that, whatever I was just thinking, but I like to use this comparison where a person says it doesn't matter how you drown. If somebody drowned in 2 feet water and somebody else drowned in a 6-foot pool, y'all both drowned. So I feel like Simone has every right to be able to sit out if that's what she needs.
Yeah. Holly, I know that this is something that not just Black women, but women in general have to deal with. They have to deal with choosing between their own mental health, their careers, whether it's even motherhood at a time. Like, so when you see stories like this, and there was a lot of people that were out there just calling her, a quitter, or, and because she made these type of decisions, or she made this choice. So my question to you is, can you speak on the double standard of women in the workplace, and from your expertise about choosing career or choosing self and health, and really how people feel like they have ownership and autonomy over over a woman's body. That's what I'm looking at. I know we're talking a lot of medical stuff, but it's really like, because she is an athlete, not just the male athletes, but the female athlete, the women athletes, they feel like, oh, we have a right to dictate to you what you can and cannot do.
Yeah. So first off, Simone is just Black girl magic. As a former gymnast myself, and both my daughters are in gymnastics.
Ooh, stun on them.
Yeah, listen. I think she did something, kind of to Alan's point, was just very selfless. And I think we all at our lives have to kind of make those choices to kind of take a step back and say, okay, I've had enough, and I need to kind of just get a refresher. But going to the conversation about women having to make, particularly mothers, or just women in general, having to make decisions over career or personal development. I mean, I think that's a tough. You have to make some, like, when you really talk about making life decisions, like, okay, do you put certain things on hold to further your personal goals, or do you say, okay, well, I'm going to do a mother, and then also as a mother feeling mother's guilt because you choose yourself at times. But I will say that, if I'm not at my best, how can I be the best mom? And so I always look at, when I make moves, if it's going to be the best for me, it's also going to be the best for my children. And so, yeah, I would just say, but it is difficult being a mom in the workplace, because it always kind of seems like the moms have to have the more flexible schedule, have to make more sacrifices in their career. And then especially when we give birth, the downtime we have to take to, raise a newborn and heal, and then try to come back to work. That's all been a juggle, and finding a job that's supportive of that, if you're in corporate America, can be difficult. So, it's tough. But I mean, I don't play that. And, you know, let me know if you need some HR tips. No, listen, I'm telling you, I was with the company when I was pregnant with my first daughter, and I'm telling you, they tried to fire me, but I didn't play that. I have my paperwork together. So listen, okay.
Really? No, it's true. It's true. A lot of jobs. Yeah. A lot of people and I think it's especially, you know, I guess I would say the post-pandemic era where we just kind of, Americans got bored and decided, you know, oh, okay, it's time to open up the country back. And now we have these people who are saying, look, they're starting to realize their value and they're starting to realize their worth and not want to just be a slave to whatever career that you actually have. I also want to talk to the people who have criticized Simone as not just as a quitter, but who said that they were outraged, because you're not really outraged. What you're really outraged about is that this young Black woman who is in a sport, who is dominating a sport and is the greatest. That's not up for debate. She is the greatest gymnast of all time and most decorated gymnast of all time, and in a white dominated field. And she's telling you, I'm going to do what's best for me. And this has gone back, even if we talk about slave narratives, where this dominant society feels like they have autonomy over Black bodies, where they feel like they have autonomy over what we can and can't do. We're seeing this now. What we have every other day, we see a video of what we call a Karen, you know, telling Black folks what they need to do or how they need to act or how they need to behave. This is something that has been going on in society for far too long. And for her, right? So now it's one thing for everybody to disqualify Sha'Carri Richardson, right? Everybody's like, oh, yeah, that's fine. But then when Simone decides, oh, okay, I'm gonna just walk away. Now you have a problem with Simone. And you got a lot of folks who can't do a cartwheel. Now all of a sudden they are gymnast aficionados and analysts. But I'm not gonna lie to y'all, Alan, I'm telling you, I was watching Simone highlights of when she was doing this stuff. And I'm telling you, everybody watches the Olympics, and I know everybody has that thought, like, I could do that. Because I was telling who I was watching it with, I was like, look, if you give me 3 weeks, I can get up on that little vault thing. I could run. I may not run fast, but I can get up there, do the little handspring. I may not land right, but I'm sure I could possibly do a little something. So
I'm breaking every bone in my body if I did anything.
You know what?
I said I'll be breaking every bone in my body if I attempted to do anything.
I can at least do the ribbon. That's a competition that I'm like, yo, I can do the ribbon thing. And I know I'm not the only one. Look,
so you know how to do a backflip. In the front. No. You know how to do a backflip and a front flip.
Nah, I'm gonna do other things. Like I'm gonna do the ribbon like this, and then I'm gonna do the ribbon like that, and then they're gonna be like, all right, we got some extra points. I'm gonna put a nice little, a soundtrack on. Just
I don't think that's how that works. I don't.
What do you mean?
It's a good workout. You should try it. Gymnastics. Go to open gym. It's a good workout.
My niece is actually gymnastics, and shout out to her because she actually got best overall, and she just started, and she is 12. So I'm probably gonna go to the crib and because we're taking a Universal this weekend. I'm probably gonna rock her medal at Universal just because I haven't got no medals. So I'll rock hers. But yeah, back to Simone. I really think that for someone who's highly decorated, it takes a tremendous amount of focus to do what she does. Or all jokes aside, like she could seriously injure herself, paralyze herself if she's not mentally there. And I think it speaks more to a message to young Black girls to say that your mental health and your value of who you are, as a person and your body is more valuable than gold. Like that's the real message here. Like she's like, look, I can risk this and I can go after some more gold, but this right here, who I am as a person. And then I think she put out a tweet that said that she didn't realize, with all the love and the outpouring of love, that she was more than just a gymnast. And how many times do we? And I ask God, how many times do we fall into the trap? I mean, I have of your identity being wrapped into what you do rather than who you are.
Absolutely,
yeah. I don't know how you want to speak on that, because I know a lot of people get wrapped up in their careers and they think like, oh, this is who. But you're more than that. You see what I'm saying? Or Alan? Or
Yeah.
Go ahead,
ladies.
Oh, sure. So for me personally, I don't know what it was. I had someone like hit me up in the DM and ask, he's like, "Are you always professional, like all the time?" And I was like, "What do you mean?" He's like, "No." He's like, "I want to see what you're like just chill and, you know, like do you like twerk or like." It was like kind of like one of those random things. Like I guess because I just always came off professional or something, but I just always like he felt like there was like this other side, and I kind of was like, yeah, there is, but not in that way. So, I mean,
you spitting game, Holly.
I was gonna say define not in that way. What does not that way mean?
Right. So, like for example, like my relaxation time or me not being so professional is not me necessarily going to the club and partying and dancing. Right. For me, mine might be like, oh, I like to take walks on the beach. I like to go to different workout groups. Me is just, I like to go volunteer. I mean, it's not, you know what I mean? I don't know. I mean, we just all have ways of taking different mental breaks. Yeah. And it doesn't always require getting drunk or, you know what I mean? Like that's just, some people think that's the only way to see another person's side, but you can catch me giving to other people and you realize, oh, she's selfless. And that's just a consistency across her professional life and who she is outside of work. You know what I mean?
Yeah. So yeah, for sure. Yeah. I think that just kind of comes from us being conditioned, especially as African Americans, to have, and it goes beyond linguistics too, like some sort of code switching. Like, so people don't believe you are who you are within the workplace, because a lot of us have to change who we are outside of the workplace for survival. So a lot of times it is a shock to people to be like, oh, you are the same whether you're at work or whether you're not at work. Or that's why people issue you these questions. Like for me personally, I've always felt like I was consistently the same person, just as far as persona is concerned. Like I feel like my persona is the same whether I'm at work or I'm not at work, or even if I'm drinking. I feel like my persona is pretty consistent. That being said, of course, I do have
when I'm drinking, I'm different.
I definitely do have like different pockets outside of professionalism that isn't necessarily conducive with who I am at work, which is why I never mention any of my employers on my social media. But that doesn't necessarily make me a different person per se. So, I do think that everyone, especially someone who's super young, kind of goes through that period of trying to figure out if there's some sort of intersection between both, or if there does need to be, of course, depending on the profession and their personality, and maybe if there doesn't need to be, of course, depending on their profession and their personality. So I think that's definitely the growing pains of adulthood that a lot of people don't necessarily speak of. Just figuring it out, on and off camera, for lack of a better term.
Right.
Yeah, I know. I
agree.
Did you have something to say?
Yeah, I was just saying that I agree. I agree with Alan. I feel Noble. y'all know how it is. Stay at home.
Yeah,
stay at home parents. But it is difficult to be yourself sometimes in a workplace, and I feel like that's usually for Black people when they're in an environment, or if you're not used to being around diversity. And I feel like diversity and inclusion and is a conversation that just needs to be held more in the workplace, just about diversity and how to identify different things. We have this whole conversation about implicit bias, things like that. It just needs to be introduced more, like in a lot of working areas. Stereotypes, stigmas, all that type of stuff just really needs to be more talked about. So But yeah, that was just my thought process about it, especially like being on camera. Like I always tell people, yes, I am a completely different person when I go to work, because at that point I am working for my employer who cuts my check, and I cannot talk any kind of way when I am on camera. I turn into a reporter. My voice gets deeper, my tone gets quicker, and my response is professional, how it should be. I feel like on TV.
We don't get the deluxe package. We don't get the Giovanni deluxe package on the Soapbox. Is what you telling us?
Right. The Soapbox gets the laughs and the authenticity of who Giovanni is. But there may be some stories that sometimes I get a little reporterish, but
yeah.
But so
the shoulders go back a little bit, and you just
exactly.
She did that lean in. I will say, and I know
TJ Legacy says that the Soapbox is the leading body.
I think for me, I dealt with that, with my struggles with mental health and really, I think with any man, like if you don't have your purpose, you're really no good to anybody. And sometimes when you think your purpose is what you do, and you get kind of your identity gets clouded in adulation and the things that you can do for people rather than who you are as an individual, like who is Ty. You see what I'm saying? Not TJ Legacy Cole and the activism and being on the news or any of these other things. And so for a while, I got to a point in my life where I was just like, it bothered me where I couldn't recognize who you are. And that's one of the most precious commodities in this world is to be able to recognize who you see in the mirror every day. And so, I would tell people that even post-pandemic, like, look, you had some time to kind of get your things in order to think about what's really important to you. And I think a lot of people are realizing that family is important to them. And they're realizing that just going to a 9 to 5 every day and missing out on those moments is not really worth it to them. But I do want us, as we transition, all right, because we are going to talk about, as you guys seen in the opening of the show, we talked about the COVID-19. We're talking about vaccinations. We're talking about people who are unvaccinated versus vaccinated. And so to do it justice, right, we made sure that we volunteered. We ain't cut no checks here. We made sure that we had solicited some medical professionals to be on the Soapbox with us to help guide this conversation. First up, she sent me a bio, but the bio is like a book. So I'm just going to ask her to just kind of bring us up in. But Nurse Gertie, I appreciate you being on. And we're going to introduce you, and then we're also going to have Holly introduce our next medical professional. But briefly, is it Nurse Remy? How would you like us to identify you on the Soapbox? Welcome.
Gertie, thank you. Welcome, everyone. Thank you for inviting me. Just Gertie's fine. That's my first name.
Okay. All right, because I'm very particular. I know there's a lot of schooling. I'm not just going to have you come on here any type of which way. But Holly, would you like to introduce our next medical professional?
Yes, absolutely. So the next medical professional is my best friend of 14 years. We've been since undergrad, since we were 18 years old. And he is Lerner Edison. He is a critical care registered nurse. And so I'm happy that he agreed to do this with me and be a panelist.
Word. What's up, Lerner? How you doing?
Great. How are you guys?
Doing well. Welcome to the Soapbox. This is Giovanni Allen, and we have Nurse Gertie. I keep calling you Nurse Gertie. It's out of respect, not out of me messing up.
I know.
Give a little bit about your, and I want you both to, and thank you both for being on. Give a little bit about your medical background, so that people know that you have authority in the subject matter in which we're about to dive into.
Yep. So I went to nursing school in New York. I went to an associate program when I was in New York City. And then I moved to Florida, and nursing was very different. So I ended up going to get my bachelor's in health service administration, in which I jumped off the nursing bit and went into like case management But right before COVID, I felt the sting of wanting to go back into nursing. And I ended up going into like clinical nursing while I was also doing community activism. But when I switched to travel nursing because because Florida's salary was so low, I was like, I can't do this. But I started doing travel nursing, and it was right a year before COVID started. So by January last year, I entered into like the COVID world of starting travel nursing all the way.
Oh, that's probably her connection. We're going to jump right over to you. She'll come back on. Learner, you went to UVA, right?
Yes.
Yes. So tell us a little bit more. Go ahead.
My background is a little different. So nursing has 2 tracks. It's a traditional track where you do like associates or bachelors. I did a second career, master's in nursing at University of Virginia. It was specialized in clinical nurse leadership, and I ended up becoming a critical care nurse. That's typically critical care is considered ICU nurses, emergency department nurses. I specialize in cardiac surgery intensive care unit.
Yeah, I'm not sure. Did it turn off?
Hold on. Go ahead. Oh, I'm sorry, Leonard. Go ahead, continue.
Okay. And then I just recently started traveling as a travel nurse I would say, for the last 5 months. So the places I've been is I actually went back to University of Virginia, and then I went to Hopkins, and now I'm currently at Centera Healthcare. But I did most of my training as a newer nurse at Carilion Clinic in cardiac surgery.
That's awesome, man. Thank you both for being on the Soapboxx Podcast. I know you're medical professionals, and we have you for about 20 to 25 minutes, and we want to be as poignant as possible. So let's get to some of these questions. It's going to be rapid fire, no gotcha questions. But we really want to have the conversation because there are some misconceptions about the vaccines. There are misconceptions about what's going on with the Delta variant. So I'm just going to ask, throw it to you. I'll start with you, Learning, then we'll go to you, Gertie. Like, for those who aren't, because I am not vaccinated yet, okay, what would you say to those who are still hesitant to receive the vaccine, and why is it and why would you implore them to reconsider?
Because I know that dealing with COVID patients, my experience has been individuals now I'm having conversations with, when COVID first started, I'm so sorry, we're going to get through this, you keep fighting. But now the conversations are, are you vaccinated? And the first things that come out of the patient's mouth, unfortunately is, I regret this deeply. It's not only just the initial impact of COVID on an individual, it's also the secondary effects. I think a lot of times individuals fail to realize that once you get something, COVID can cause a whole lot of issues. And I can have 10 different patients who are impacted by COVID differently. Some individuals can have a stroke. So now, even though they have survived COVID, they're now seeing neurologists and at memory care facilities. Or some individuals, like I'm in cardiac, that's my background. They say, hey, I had COVID 6-8 months ago, but now I'm in the clinic because I'm a heart failure candidate. And so it's important, I think, that individuals get vaccinated. And what I really want to preach to people is vaccines that do not stop you from getting the virus. It just prevents severe hospitalization and mortality. So
Right. So I know that there was a lot of the CDC came out, and I think my issue, and I'll tell you this, and I'll be honest with you, and I'll tell you this, Gertie, my initial hesitation was that I read even from Dr. Casper in University of Illinois and a lot of medical professionals, they said that the virus mutates. And so it will continue to mutate. And so even those who are, even with the CDC announcement of initially people who took the vaccine because they said, well, I don't want to wear a mask anymore, so I'm going to go ahead and get the vaccine and I should be good to go. And I can walk around without a mask. Now with the Delta variant that's going on, the CDC came out and said, well, even if you're vaccinated or unvaccinated, everybody still needs to wear a mask. So a lot of the different information and uncertainty that has come out from the CDC and what's being reported on whether news outlets, and then you got social media people who consider themselves medical professionals on social media. How much? I guess my concern is does that concern like about the mutation, right? Like once if you are vaccinated, I'll start with you, Gertie. If you're vaccinated, but the virus mutates, will you have to be vaccinated? Will you have to be vaccinated again? Hold on, let me see. There you go.
So can you hear me? Yeah.
Yes,
To start
I can
that, yep. And also the other nurse can vouch for that. So viruses do mutate, and which is one of the reasons why we need vaccines for them. So let's just take like the flu vaccine, for example, that people take. You and I spoke how I don't take it because when I did take it, I got sick. And also the flu vaccine is given with the current flu. But COVID is a family of SARS, and SARS has been around for a while, and it has mutated, and we have had little episodes of it before, but not in such great strength. So what's happening now with the Delta and COVID is that the Delta variant, they say, has a stronger outer shell. And because of that, it clusters, because viruses like to pretend like they're our friends, right? They enter into our bodies, they mix within our cells, and then they attack our bodies, such as like HIV and other sort of viruses. So the only thing that is able to, I don't want to say cure, because there is really no cure for viruses. There's vaccinations to make your body recognize the antibodies. And then once it recognizes the antibodies, your body will fight back. So it's not a cure, it's a protection. So your body's own protection would kick up. Now, when people think that they can just take the vaccine, a lot of things have happened when I saw the vaccine. I got vaccinated in January and February when they were vaccinating all the essential workers. Well, I took the Moderna because that's the one I trusted most because the way it was cultivated, the people who created it, and the fact that it was actually outside of the United States, and it was by scientists that I trust and read about. And it was a 2-step, and it had a bigger efficacy rate. But you need to take the first one, and 28 days later, take it again. And you're not fully safe until 2 weeks after the vaccination. So there's a lot of variables that goes. Was the vaccine, had the person just taken the first dose and felt they were safe and then went outside? Had they taken the second dose and not wait till their own immunity started kicking in and then they went outside? You also know that it has to be refrigerated. It had a certain amount of time that it had to be cold. Had the person who was giving it, did it stay out too long? A lot of vaccines had to be thrown away because they were outside too long. So there's a lot of variance into why the Delta variant got stronger, because viruses become stronger as our body weakens. And so I think with the first COVID, like you said, people thought they were safe. They went out into crowds, and then they thought that they didn't need to. Do we need a third one? I personally have been vaccinated, like I said, since January. I work on COVID units. I've worked with people who died of COVID all last year and up to this year. I had units where I would come in and 6 of my patients would be dead. I would leave 10 and only find 4. Of course, we wore masks, we wore face shields, we were totally protected. I felt more safe in a COVID unit than I did when I went back home in Florida. So you still have to, number one, wash your hands, right? I always tell people, you can put all the masks you want in the world, but if you're not washing your hands, you're touching doorknobs, you're touching people, and then you're sneezing and wiping your nose, and you're taking the mask off with your hands that was not washed or unsanitized, you're basically reintroducing the virus to your nostrils, because that is the only way that it can enter, really, the nostrils and the mouth. So a third vaccine, I would say, would be okay if they had 100% statistics that it does work. My 2 vaccine worked perfectly for me, having been a nurse, working with COVID patients, working with patients who've died, but still carrying my mask and washing my hands. So I am protected. Now, if the other 60% of Americans would do that, then we would probably eradicate it like we eradicated polio, mumps, measles, rubella, and that's what it takes. It takes 100% work. It can't be start and then not finish it up. So I don't think we need a third vaccine if people were more careful.
Lerna, do you think that we stopped quarantining too early? And how serious for those people who, because I know, Gertie, you touched on the Delta variant. How serious is this Delta variant from your expertise of what you've seen in your unit and what people are going through? Oh, did you freeze? Oh, go.
Yes, I think that the CDC unfortunately did make too many early recommendations.
Pretty much. Oh, I'm sorry, I wasn't sure.
No, that's Learner. Go ahead, Learner.
I think the CDC did make too many an early recommendation to stop the mask mandate. I think I did not really agree with that decision. We also see that is coming back to be a crucial part of preventing the spread. Unfortunately, with every mutation, the virus is stronger. I think, according to the last article that I read on this fact, is that the Delta variant tends to be 1,000 times more infectious than the Alpha variants, which was the first variants that we had when dealing with COVID. So therefore, the efficacy of the vaccine itself is reduced. And the caveat on that as well, I think that moving forward, what I'm also seeing in the hospital is that the patient population is getting younger and younger. Typically, when COVID first started out, it was the older population. They had a lot of, we call it comorbidities. That means that they have other conditions. But now, because of the mutation, it seems that the virus is more attached to the younger population. One reason is there's a lower vaccination rates amongst younger Americans versus elder Americans. And so I think moving forward, we need to reconsider two things: the mask mandates, restrictions, social distancing, washing their hands, and also possibly a booster shot. Just like you get the flu vaccine every single year, I think there will also be something possibly come along those lines as well in the future.
Alan, Holly, Giovanni, did y'all have a question for Learner? I think Gertie's popping. She's having an issue with her Wi-Fi connection at her hotel. That's why she keeps popping in and out. So forgive her for that. But yeah, go ahead. The floor is yours.
First off, Learner, appreciate you coming on. My inquiry was more so just like I wanted to have you inform our audience in regards to, I understand that the basis of the vaccine was started, if I'm not mistaken, over 10 years ago, almost 20 years ago. Can you kind of expound on that? Because, I understand that the young lady was speaking about is just kind of like a family. So we had already starting to do work on it a while ago. So I know a lot of people's pushbacks is, how could you guys have come up with this vaccine, in such a short amount of time? And I understand that it hasn't necessarily been a short amount of time since the groundwork has been laid for that. But if you can just kind of expound on that and your more expertise knowledge, because sometimes, my vernacular doesn't really get it done.
So I do want to caveat, I'm not an infectious disease nurse. I'm, my background for the critical care aspect of things. When you are critically ill, that's when I come into play. We do vaccinations. Typically, a vaccine is a live virus, like I would just say influenza, the flu virus. The unique thing about the COVID vaccination, that's what we're going to call it in this podcast, is that it's an RNA synthesis.
Tell us what's the correct terminology if we're saying it wrong. What is your terminology?
Well, there's a lot of different terminology that can be used for the vaccine itself, but to caveat different names for it, we'll just make it simple with the COVID. But it's an RNA synthesis, so that has had many, many, many years of research. It just never was authorized to be released to the public. Okay. And so when COVID came along, and basically the scientists, the medical community was kind of like in a desperate need to find a solution. They allowed the creation of the vaccination processes, which is usually found among the Moderna and the Pfizer vaccinations, which is the RNA synthesis, to prevent pretty much protecting the cell itself, to prevent the receptors from binding and creating a certain level of antibodies. Basically, we call that as a defense mechanism against a virus to protect yourself. So the vaccine itself is not a live virus. That is the difference. Not really a live virus. It's a processes in order to create a defense against the virus itself.
Okay.
Thank you so much.
Which out of the 3 FDA approved, which one is the most effective, if that's even a thing? Which one has been proven to be most effective based upon data that you've had access to?
I just want to be a responsible nurse in this matter. I think there are.
Okay, I want to do up. Go ahead.
Just go get your shot. But
yeah.
I would, I got Pfizer. The reason I got Pfizer is because, the caveat on that, I just felt like a lot of the evidence, Moderna and Pfizer are the two strongest vaccinations that have a lot of studies in Israel, UK, Canada, and here. So I just felt a lot more comfortable getting that vaccination. And it did not require a temperature. So Moderna required a refrigerating temperature source. I don't know if that's still into play, but I do know at Pfizer that was not a factor. Because if the temperatures weren't correct, it reduces the efficacy of the vaccination.
Okay. Holly, did you have a question?
No, I mean, I have learner on speed dial, so if I got any questions. We talk every day about this stuff. So I mean, listen, we talk every day about this stuff, and he got Pfizer, so did I. So it wasn't.
The vaccine is the vaccine for everyone? It's not available to children yet, correct? Or is that wrong?
12 and older for Pfizer, and then I think it's like 16 and up or 18 and up for Moderna, I believe.
But I think they're working on the processes of allowing it to basically reduce the age.
Yeah, so it is in trials right now for the young kids. Pfizer has the trials. They're just figuring out the dose. And the tentative timeline for the Pfizer vaccine for children between the ages of 2 to 11 is both they say October, November. Biden did release a statement this past week saying it should be soon. So that's relative. So we'll see.
And I want to
I guess. Oh,
go ahead.
I do see a lot of vaccination amongst African Americans and people of color. And I mean, that's a whole nother conversation itself as well.
Well, I want to touch on that, and especially the hesitation part from for the African American community, particularly. But I want to get Gertie. Gertie, what is I asked Lerner what his preference was, and he kind of gave his personal opinion. But what is your opinion on which of the three are, based upon data or even your personal, your experience has been the most effective?
Yeah. First, I want to say I'm sorry I had to turn off the video because I was getting connection issues. I chose the Moderna because it was the one that required strict refrigeration. In the hospitals and nursing facilities, all of our vaccines are refrigerated and they can't stay out. So the reduction of the efficacy is how long it's out. So because of the fact that whether I'm giving the flu vaccine or the pneumovac, we do keep it refrigerated. Every single vaccine that are virus-based is in the refrigerator. I trusted that a little more. And I've also seen where I actually had an experience where, and it was a representative from CBS that was giving the other one and they kept it in their pocket. So that was an infection control issue because I do infection control also. And also making sure that it kept at the right temperature. So I had a lot of uncertainties, but Pfizer is a close second. Had they not given the Moderna first, I would have chosen Pfizer. Although at one time when I was doing the vaccine drive, we did do the other one, the one that's one dose. I figured that someone might as well have something than nothing. So that was pulled off the market. But getting back to, I know we're going to touch base on the African American and people of color and the sickness of COVID and vaccination.
Yeah, we can do that right now. Why do you think? Well, is it valid, right? Because I know when I did the interview in the Miami affiliate, they talked about people bring up, and I'm sure you heard this too, learners, that when people in African men, they talk about the Tuskegee experiment, they talk about the distrust in the government. Are those valid concerns, or what as medical professionals, what is it that you say to African Americans that are hesitant, or do you just say, hey, it's your personal choice, okay, do what you got to do, here's the information? What is the I guess you would say pitch to the African American community? And I'll start with you, Gertie, because you said you went door to door.
Yeah, right. So first, I am a Black woman, a Haitian American woman, and I'm in the medical field, did case management and community service. So firsthand, I've seen in all four of these things I mentioned how the Black and brown community has been disserviced all the way around. right? I know in medical fields that they are disserviced, right? Because they do come with comorbidities such as diabetes, hypertension. They come with liver disease and cancers that are untreated, cancer that are treated by white people and they get, their medications and treatment because they have insurance. But then the person with breast cancer that happens to be Black may die less than, faster than someone else. So with that alone, not trusting the health companies, not trusting that more Black women of color have death when they have their pregnancies than a person that's white. So the Black community, our Black community, has a valid point in not trusting healthcare, not just because of Tuskegee. You have Puerto Ricans who they were sterilizing women back in the 50s and 60s. So we have a history of the government linking with the medical field, treating our Black and brown people with disservice, using us as guinea pigs, right? So I do validate that. And that is for the very same reason why I went door to door. Be angry about what they did to our history, but at the same time, know that we matter enough that this vaccine is being offered. And here's the perfect example. It was being offered in people of color neighborhoods and Black neighborhoods. And you got people from the villages who were coming down to get it. Privileged white people from their villages were driving to impoverished areas because we were not taking the vaccines, and they were taking it because they know that it's something that will be beneficial to them. In the meantime, I'm seeing our people, especially natives that were in New Mexico, they were dying of that at faster rate. If somebody comes in with COVID, like he said, he's in the ICU or intensive care. By the time you get to his unit, they're pretty much already having systemic failure and close to death, right, on the ventilator and death. We want to get them before then. So if you take two people, a Black woman and a white woman, and you have both, but one have hypertension that's undiagnosed.
Oh, well, we're going to pick her connection is bad. This is okay, Lerner. It's the Olympics, so we're just going to pass the baton to you. What do you think? Go. Yeah. So in your so based upon, what do you tell people when they come in? I mean, because is that true? Once they get to you, it's pretty much like, hey, we're just trying to, like, what is the correct terminology? Are you just trying to make them comfortable? You're still trying to treat them, of course, but it's that severe where it's life-threatening.
Yeah, when you're in ICU, it's pretty much at that, point of do we intubate or not. And that's the whole process in itself. There's tests, values and things that we go off of. There's your clinical, we call it clinical presentation. And then from there, the medical team, make that decision. And then, once you're intubated, some hospitals are better than the others, but statistically speaking, it's a long road to recovery. So in that regard, and I don't know if you wanted me to caveat on the hesitancy in the Black.
Oh, absolutely, yes.
My ethicist professor always said, for you to understand a situation, you always look at the contents of history. And I think we need to look at history in a sense of like African Americans in general, like all the experiments. Unfortunately, University of Virginia has a deep history, and like the medical community, actually some of the top medical providers during that period were UVA physicians who ran the Tuskegee experiment. So when I do talk to African Americans about vaccination, the importance of vaccination, the first thing that comes out is like, I don't trust the government, and there's not enough people in healthcare that look like us, right? So that is one of the main factors. It's like, if there is more African Americans, more representation of that, it's a lot easier to convince a certain group of population that how important this is. So I take every moment, every opportunity to let them know, like, hey, we're here for you. I understand your concerns. And I allow them to speak, and it seems that a lot of the information that they're receiving is misinformation about there's something in this vaccine, there's something in this. And but I always tell them, do you want to prevent something from happening, or are you going to allow it to happen? Because now you're seeing my face. So you're seeing my face that there's something really critical going on. And the greatest impact that you can always have with families and things like that is once a family member is infected with COVID. As a nurse, I take deep and great passion into educating the public, especially that family. Hey, look, your mom, your dad, your brother, whoever is in ICU, this is what's going on. Are you vaccinated? And we can have those critical conversations.
Do you see?
My question.
Oh, go ahead, Jay. Go ahead, Jay.
Hey, this is Shivani. Definitely happy to have you on today. I just wanted to ask in general, for those who are set on their, I guess they're just not going to get the vaccine no matter what precautions do you recommend individuals take to make sure that they are healthy, or to make sure that they are doing certain things so that if they do catch the vaccine, maybe they won't be in a situation where they have to be in the ICU? Is there anything that people can do now?
Well, yes, the mask, social distancing, restricting travel, hopefully that your employer doesn't require you to come back to work. These are all factors. If you have children, hopefully the public school system is taking a very crucial role in protecting the children. So, because a lot of times kids can bring home things to their parents, and also not having huge gatherings. Kind of like going back to what we were a year ago. But I got to be quite honest, as this virus continues to mutate, it's harder for the mask to be more effective. I remember if I wear a mask and you wear a mask, the infection rate was at 3%. I think they're starting to do studies on that again with the Delta variants. So I would just recommend those precautions, constantly washing your hands, and also, getting your routine checkup with your providers as well.
Mm-hmm. And that's something that I feel like the people, especially in the Black community, like a lot of people don't have primary care doctors. So when people come to the ICU, or in general just the hospital, and then they're saying like, oh, somebody's life couldn't be saved, does their medical record, or not being able to find their medical record, have anything to do with that? Or you all don't consider past medical records before you treat someone?
We consider everything. If I can't find a record, I will search for a record. The closest person to that patient knows the medical history of that patient. So, if they have, and that's a true fact. There's so many people of color that I come across in the healthcare system, like, wow, this is so preventable. This condition is so preventable if they just had insurance, if they just had the education, if they just had the resources. But unfortunately, about the time you get to the ICU, we're having conversations about, okay, what is your advanced care directive? Who's going to be in charge of making decisions if you cannot make those decisions? And, and I need to know as the critical care nurse, so I can, collaborate with the team, what some of the things about this patient that you have noticed recently, or certain changes or things like that. Have they been complaining about anything? Even if they don't have a history, we can collectively gather information, gather signs and symptoms, and run diagnostic tests to find the answer.
Okay, yeah, that's good. Thank you.
Yeah, because I know for me, like I said, I haven't been vaccinated, but I do have a primary care physician. I have tested for COVID. I don't have it. I've had my lungs scanned. Like I've done everything, but I still wear I never stop wearing the mask or washing hands or any of that stuff, even because we live in Florida and our governor is off the chain, where he just wanted everybody to just, he's something else. I don't know if you heard about him. His name rings bells out here. Huh?
He's nationally famous.
But the thing is, that's what he wants, because his policies are playing to his base, because he's more so worried about re-election than he is worried about the health of Floridians. I'm gonna stick with Learn, and then I'll get to you, Gertie, because I know you're on standby. So do you think we're heading for another shutdown where everybody has to quarantine and due to the Delta variant?
I can't predict that, because that's becoming a political decision. I just think if COVID spreads the way it's spreading, and there's more mutations, and the mortality rate is increased, I think that probably will be under reconsideration. I can see that happening, most definitely. And I can also see us, if they do a booster shot, that's what they're going to call it. People that are vaccinated are getting revaccinated. That is under consideration too.
And that's I think that's was one of my concerns. It's like if I get 2 vaccines, and then am I gonna have to go back? And we're gonna have to go back. And I don't even like people drawing blood from both arms. That's just how I am. Like if you draw blood and you got the stick and you ain't right, you ain't got the anointing that day, you're not getting to the next arm. I'm gonna call for somebody else. So I think people are gonna be extremely hesitant, especially when they start, with the children and whether or not they're going to be back. I think that's going to be a huge problem in the country trying to get people under 12 years old to be vaccinated as well.
At what cost, right? I just say, you don't. I'm sorry, but you don't like people joining your arms. But if you come see me, I gotta get.
Larry's like, I don't want to hear none of that. Shut up.
You're gonna be sedated and stuff, so it doesn't matter.
You don't want to get to that last step.
Larry's like, in the ICU, this is me. I run this, okay?
So my other question is, at what point do you know, hey, I need to go to the hospital because something is not right?
So I'm gonna be honest. If you go to the hospital and you're saying I don't feel well, you're going home. Now, if you go to the hospital and you are having respiratory complications and they monitor you, there's a threshold we use. Yeah. And from that threshold, we determine which unit you're going to go to. So it'll either be a step-down ICU or the floor, we call general floor med-surg. Or, once they say intubation criteria, then you're coming to the ICU, and it's a direct admit from the emergency department.
Okay.
Go, Alan. Go ahead, because I wanted to get Gertie in here. But go ahead if you have a question.
Well, I mean, this is a question for both. So also a lot of the pushback with the vaccine is, we don't know the long-term effects. We don't know the long-term effects. Always my pushback to that too is, we don't know the long-term effects of COVID either. So it's like you gambling either way. But if you all can kind of explain I know we touched on it a little bit earlier in regards to the respiratory issues, and being a candidate for heart failure. But what are some of the other potential long-term effects? I know people who haven't been able to smell anything in 6 months, and that's just on a surface level. So if you all can kind of expound on that as well.
Great. Why don't you tackle that, and then Learner, we'll get you. We'll let you cool off for a little bit because you've been hot. Let's go, Gertie. Go ahead. What are some of the effects?
Yeah, exactly. So because I've also done long-term care and subacute, I've seen once they come back from the hospital, a lot of the long-term effect besides the smelling are mental changes. You have people now who are younger and they're having dementia because that portion of their brain suffered some sort of damage. People with forgetfulness, a lot of organs that fail, depending on the organ, some of them don't have the cells to regenerate and they will continue to fail, like the cardiac, like your lungs. People who had COPD before, they may end up with scar tissue in their lungs that do not get better. And if they were smokers prior to COVID with the scar tissue, they may suffer lifelong respiratory issues. There's something that was called COVID feet, and I've seen that close to when they were about to die. Their feet get dark and gray. Sometimes you don't get that color back. You're losing your bones, the strength of your bone marrow. That is kind of weakened. So it's a systemic failure because not only does it go into your lungs, but the air in your lungs goes throughout your body and your veins and your arteries. And so pretty much as the virus is contained in the lung, the damage that it does, it creates us to have bad air exchange, which create different systems of our organs to fail. Because our whole body needs the oxygen to function. So wherever that oxygen was lacking, and we know our brain is one of the last ones, it's going to keep that oxygen for itself no matter what. So it will start shutting down your stomach. It will start shutting down. Some people have like gastric issues. A lot of the body parts that are not a main function or main organs will shut down. Will they come back? Well, that depends on what the person had before. If they were a very healthy person prior to this, they will recover and maybe have very residual effects. But if they were like your 90-year-old grandma or somebody who was younger but had issues, they may not get full function of their bodies. And aches too. A lot of COVID caused pain in their bodies and muscle pain. And those kind of stay, although they come back to work, you hear them saying, yeah, I'm still in a lot of pain. I worked in a facility that 95% of their staff had COVID. They hired us nurses from agency, and we were the ones that were not. So as they were coming back to work, they were still coming back looking sick, looking gray, still coughing, but of course not having the proper pay or time off. So they had to come back to work, although they were not actively sick. There were 2 weeks in post illness, but there you can see that they were still very fatigued, and that doesn't go away. Getting back really quickly, because I was thinking about that when you were saying about getting second doses and third doses. We touched base on that a while ago in our phone conversation. So when children enter the elementary school system, right, and when we enter professions, right, we have the MMR, for example. MMR is given in doses, right? Your child gets it as soon. Actually, when moms give birth, they're getting that first dose 2 days old, 48 hours. And then they have to come back within a month and then come back within 6 months. They're taking 3. The hepatitis B vaccine, me as a medical person, I had to take it. You take the first dose, and a month later, you take the second dose, and then you take the third dose. People don't think about that. We have actively been doing this for maybe like 4 or 5 decades already of taking first and second and third doses. Some people, even though they have chickenpox, like they end up with like shingles or they end up with the chickenpox virus. So they sometimes take the chickenpox vaccination. We have for decades have been taking multiple doses of vaccines before we even enter elementary school. That is 4 and 5 years old and maybe pre-K. So we as parents or as society have trusted these vaccines. Actually, was it, I think, the tetanus, right? You get a tetanus when you're young, and by 7th grade, you need a booster. And every time one of you step on a nail, you go and get a tetanus vaccine. That is a virus. And some people get it every 10 to 20 years, that tetanus vaccine. So we have been getting vaccines in multiple doses for decades. That's one. The second about it being rapid, I have this thing, and I was talking to one of the person I got to get a vaccination. I said, okay, you guys we all watch TV shows of like Contagion and all this other stuff, right? And everyone's like waiting till the end. They develop this vaccine that's going to save the world, and then we can go back out again, or we can be safe again. Outbreak. We're rooting for that. Watching TV. Outbreak, right? We're all rooting for that, right? We're rooting for the vaccine that they're created within 3 months or 1 month. And we're like, get the vaccine. Well, this is real life, folks. The vaccine is here. And people are saying yes to outbreak, yes to contagion, but they will not take it themselves. And who's not doing it? Most of the Southern South Republicans, because I work in Alabama, Mississippi, and Georgia. And our people, our Black people are not taking it, and the white people who believe in 45 are not taking it. That's one. Who's not taking it? People from the islands who are afraid because of what they did to us. So this vaccine is something that is not saving us. We are hurting ourselves by not taking it because we drink Coke, we take Tylenol, we take antibiotics. Somebody has a UTI, what you gonna go to? Go wait, and sometimes they give you, and you can vouch, they give you an antibiotic before they even know what it is susceptible to. So you try one antibiotic, you go back and say, oh, it didn't work, let's try another one. Do we know what that's doing to ourselves? Tetracycline is a very dangerous antibiotic for the liver, right? Some of them, you gotta monitor your liver function and your kidney function, but we take that on a daily basis. So I'm not here to, put somebody down who's not taking vaccine. I just want to let you know that the misconception is killing us. The misinformation is killing us. And who is the one dying? Our Black and brown people, impoverished white people, because we have lost faith in government because they created it. We didn't lose it because on purpose. They created that loss of mistrust. But we have to trust ourselves and trust our medical people. We have to trust nurses and doctors and scientists who have been in the field, who have been around. Like you have this guy who work in it. I work in it. And you know what? Before a medical person tell you myths, find out what's their experience. Where have they been? Who have they seen before you take their word for it? Because we have been in it since day one and seen the positive and the negative. And I'm not saying it's for everyone, Think about it, but just know that we are the one dying. Black people are dying, brown people are dying in groves, in numbers. And it's about time that we start taking care of ourselves, believing in ourselves. Okay. And that's what makes me a little upset about this whole situation.
Damn, you see that Wi-Fi? Once that Wi-Fi got connected, she just came with the heat. Was like, "Look, I am playing with y'all. I am not playing with y'all no more." Look, she could have just at me. She said, "Black men in the South and Caribbean."
Yes.
I'm sure that and Caribbean. I was like, "Damn, just at me." Like she's just gonna say, "All right,
And
reconsider some things." You know. Go ahead, Alex.
Listen too. It's just funny, and I like what she said at the end. Is make sure that even if you are listening to quote unquote medical professionals, make sure you check their credentials, because I done seen a lot of roadside assistance medical professionals on the internet giving false information and spreading conspiracy theories too. And just because she got he or she have a white coat on, people will eat it up. And if they say their cousin work at the Pentagon, don't believe that person, because they don't have a cousin that work at the Pentagon. And just I thought that was extremely important to make sure that you check the credentials too, because there's gonna be sheep in every field, so you got to make sure you listen to the majority.
Absolutely. Listen, I want to be respectful of both Lerner and Gertie, your time. Lerner, I'll give you the floor to give your closing remarks. And I also wanted to touch I want to say how reliable. I don't want to put you in a corner, but the CDC, like how much should people be focusing? Because we talked about the avenues of information. Should we be focused on the CDC and paying attention to those reports? And that's the only source of information. What's the most reliable source of information besides the Soapboxx Podcast with you on it? What's the most reliable source where people should get their COVID information?
I think the CDC is a crucial component of pretty much this COVID, from a national standpoint, this COVID policy. But there's the World Health Organization, there's the NIH, there's even Johns Hopkins is actually, I think, the largest collector of data for COVID, and also big major academic institutions, and here it's UVA, VCU, Duke, etc. And you also want to make sure that the articles that you're reading are based in research and evidence. So it's cited, you can actually look these individuals up and actually, figure out their background, because if it's cited, their names are on these articles. And, then you can be able to okay, what kind of physician, scientist, or whoever they are. So I think that is how you can expand your knowledge. I think I like to make decisions off a collection of information, because one article may say one thing, article may say another thing. Remember that all of our backgrounds, if you have a, background in research, that some research studies are stronger than the others. So that's where I go. That's where I tend to go. I tend to rely a lot on, unfortunately, it used to be the CDC, but lately I've been pulling more of my resources from a lot more my nursing background research from those articles to make decisions. But the caveat on that, I just strongly believe in the vaccine. I strongly believe in science. I think everyone we have dedicated our lives to caring for humanity itself. So I love my people so much, and so it just breaks my heart sometimes that most of my patients have been African Americans. A lot of them unfortunately have been unvaccinated, and some of them, the saddest story I've ever had was, a new mom, never saw her baby, gave birth, and we immediately intubated her. So I just want that to stick, because it's just there's powerful stories out there. I can't share all the details, but this virus is running rampant, and I just want people to get vaccinated, because you take that first step to get vaccinated, you have some protection to survive this pandemic.
Okay. Look, once again, I appreciate you and Gertie being on here. If you want to, because I know you're a medical professional, you probably don't want a whole bunch of hate mail, whatever, but if you want to share your social media, or where can people find you if they want to get in contact with you directly with from Soapboxx Nation, our base? We can't just let Holly just be the only one that just gets all this free medical advice. Like, come on, she ain't paying for nothing. I'm sorry, Holly ain't paying for nothing. She just, well, what's going on today? He's like, school.
Well, I have an email. I have a LinkedIn and an email. I don't do like right
That's
now.
fine. I just want to give everybody an opportunity.
Smart man.
If you want to share.
Yes, so you can reach me through. I'm joking, but you can reach
through. That's it. No, I'm not gonna lie. When we set this up, Holly was like, "I'm engaging." I was like, "Yo, I just want to touch base with him." She was like, "What? Like, okay, how long?" Okay, she set it up. I was like, "All right, look, man." I called. That's why I sounded like that on the phone. I was like, "Look, man, I got 3 or 5 minutes. Just want to have a brief conversation with you. I ain't trying to get yoked by Holly." But go ahead.
But that is a source. But if you directly want to reach me, I'm on LinkedIn as Learner Lee.
Okay.
And there, I actually respond to that very frequently. Or you can do my email is LLE. I'll just doledison2@gmail.com.
Okay.
Yeah.
Appreciate you, Gertie. Where can folks find you?
They can through Facebook Messenger as Gertie Remy. I think there's only one or two of me, and but they would have to put like medical question on the title because I don't usually open all of them. But yeah, as far as like getting information, like he was saying, earlier last year, I relied heavily on the World Health Organization and the National Institute of Health because of who we had in office and how the CDC was greatly defunded. But I guess the CDC is getting more funding so people can get their information there. And I think like when we want to like be very accurate when you're Googling or asking questions, like because the CDC and the World Health Organization are very vast. So if you wanted to pertain to like your area or statistics in your area, just put that in and then to get more information. Definitely Johns Hopkins because they have been very involved and a lot of the practitioners are very credible. So you can get information from that. But on the last note, I want to thank you because I know he's seen it, but for the 2020, I think I've seen about 100 deaths in COVID. And every one of those deaths touched me personally. You're left unchanged. Like you're not left unchanged, I meant to say. So when I finally stopped traveling in March this year, I was going to totally leave nursing 100%. And then of course I jumped back in May, but that's because I think we're going to there's a lot of things that's going to be happening to medical people later on. We've been wearing masks and goggles and face shields, and I'm talking about N95 masks for over like 15 months now, especially for those of us who do 12-hour shifts. And at times I've worked 5 shifts. So that's 72 hours plus of wearing a mask of an N95. So we probably in the near future will be suffering our own respiratory issues of breathing our own CO2. So we don't know what's going on in the future. We have been exposed to this for over 15 months as healthcare professionals. And so there's a lot more to come with COVID. But the one thing is, it bothers me that I may have to, because we're now finally wearing our blue masks based on the units. It really upsets me that I will have to once again wear the N95 and wear the goggles and wear the face shield and the gloves. And it's not fair to us because for 6 months, I didn't see my own family. I'm in a hotel now because when I work on COVID units, I don't go home. So I don't know what my home looks like. And it's not fair because we take our uniforms off at the door. We don't want to infect people. I'm vaccinated. I did the right thing, right? Vaccinated, wear my protective gear and protecting those in the community. But I don't get to see my family. I don't get to hold their hands. I don't get to hug people. And it's not fair because it's not my choice and it's not because I'm doing it. So for people who are not vaccinated, just think of the people who are out there in the field who are helping those who are dying. And It's a little selfish in a way. I'm going to be direct because I chose to be a nurse. I didn't choose to die in the field as a nurse caring for people who has disregard for what we do. You understand? Every time I step foot in the hospital or in the facilities, I'm putting myself in danger. We have to test every day. Every day we have to test. Before the rapid test, we have to do that long nasal thing that no one likes every day of my life, even if we're vaccinated. So our healthcare people are actually going through a lot of this trauma to save your lives and be a part of your hands. Because here's what I have to say. When I worked night shifts all last year, it was my hand they were holding. When people were dying and not wanting to be alone because it was no one could come in, we were on total shutdown, the last hand that they saw was a tech or a nurse holding their hands as they died. And I take that with me. That 2:00 phone call to call their kids, their families, their mom, I was making that phone call. And you take that with you, as a healthcare person.
Oh, geez.
Oh man, that was
powerful when she just spoke and then did the mic drop. But Lerner, Gertie, thank you so much for doing it. Lerner, you're welcome back anytime. I guess we'll contact Holly and make arrangements, or we got your Gmail
representative.
But I wanted to say this to Gertie and yourself. Thank you for all that you're doing. Thank you for the information. Thank you for the knowledge. Also, it's not lost on us that y'all are Black professionals in the medical field. So you guys are continuously breaking barriers just by existing and doing what you got to do. Gertie, we was just giving you your flowers. We're telling you thank you so much for your service and the information.
You're welcome. I got it back. This hotel sucks, but anyway. Thank you.
Yeah, what hotel is that? Because we're not going to endorse that hotel. What hotel is that?
I'm in Georgia. Trust me.
Enough said. That's it. Just say Georgia. We're good.
The rules of Georgia.
Oh, okay. All right. Well, we want to be respectful of your time. Please, both of you get some rest, recharge, do what you got to do. And we will hopefully see you on the Soapbox soon. Thank you so much.
Have a great day, y'all. Appreciate y'all.
All right. Bye. Oh, that was heavy, man. That was dope. That was really
a much needed conversation that we needed to have. And I hope that our Soapbox listeners are taking heed to that conversation and not only just listening it, but going to try and apply it into their lives. So
yeah. I feel kind of weird because now we got to do celebrity selling, and I know what the stories are, and I'm like,
I think we're good. Like,
you think so? Can we? Yeah, because that was heavy. Like what Gertie said, like it's definitely giving me a lot to think about. Alan, what are your quick thoughts on what we just said? Let's recap before we do. Man, what we got? We had the. I just don't think it's appropriate. So I'm gonna make a quarterback call, and we just gonna keep it with the Simone Biles and the COVID conversation that we had. If that's cool.
I wanted to add one more thing about Simone. Were you all also hearing that she was taking Adderall? Did we mention that?
Oh no, I didn't know any of that.
No.
I don't know. Some sources are saying that
is this a HIPAA violation?
Adderall is not allowed in Tokyo, and so that is one of the reasons why she had to. She chose her mental health over attending.
It's possible. I don't know. I haven't confirmed that or anything.
Were they saying that she was failing a test or something, or is this like a?
No, it's just that. When a person is used to taking any type of medical drug that helps suppress some of the things that they're going through. ADHD for one.
Oh, they were saying okay. Okay, like her like suddenly stopping to take it may have affected her.
Yeah.
I haven't heard anything about that. I won't. Yeah.
Holly, what do you think about when the information that we heard? Let's kind of recap of the COVID stuff before we get to the moral of the story. What are your thoughts on what you heard from Lerner? And thank you for the plug with Lerner. He definitely came on fire. Gertie, once she got her Wi-Fi, definitely had some heat as well. We got to get her out of the Motel 6 and into the Hilton. We gotta do that. But what was your reaction? Because you are vaccinated, so you're one of those people that
Yeah, I am without hesitation. So, so I'm vaccinated and I still wear a mask. I've never, just because I was vaccinated, not worn a mask. Why? Because I know other people aren't vaccinated, and I have kids to go home to. And I don't like being sick. I don't know who does. And I can tell you, I haven't been sick in over a year since we've been in quarantine. So clearly keeping our distance, washing our hands, and then on top of that, getting the vaccine to add that layer of protection is working. My kids haven't been sick, ain't had to use no medicine. Life's been good. Okay. But I mean, I hate it because, like I said, me and Lerner, we've been best friends for 14 years. We talk every day, and I even saw the emotion, like kind of what Gertie left us with. I mean, that emotional toll is very real.
Yeah.
And I think there is a part of it that's just like, if we can do our part to make it easier for everybody else. And I mean, that's why I think the debate is like, are you being selfish or selfish? About getting the vaccine or not. I mean, it's even drawing lines in families where, like, you're not even trying to hang around people who are like unvaccinated, vaccinated people. I roll with a crew where we're all vaccinated. There was no question for us, and we're all Black. Like, and I only talk to Black doctors and Black medical professionals that I trust. All my doctors are Black. So even my veterinarian is Black for my dog. Okay.
My primary is Black too, and that actually changed my life.
Everybody's a person of color. So I kind of have to just trust the information that they give me. It made me feel comfortable. Again, when the vaccine is available for my daughters, they will be getting it without hesitation. We vaccinate our kids, like she said, and we don't question it. Oh, they got to go to daycare. They got to go to school. Oh, they need these vaccines. Oh, we go sign them. We go to the pediatrician, and then they get the shot. And the same side effects from those shots, like fever, muscle ache, those are always common side effects to any vaccine. So it's like, whether this is new or not, I mean, mind you, a Black girl helped create the vaccine. So, I mean, I don't feel like I don't know why we would question our own people in a way, when it's like you literally had Gertie and Lerner telling us what's up. And then, we had a Black girl who was the lead person in the creation of vaccination. She's 35. She's young like us. She's a millennial. And so it's just like, I don't know. I kind of feel like what they had to say, like, I'm with them. Like, you should get vaccinated if you can. And honestly, I've been vaccinated. The needle's really tiny. You don't feel it. I got vaccinated for my kids, so they weren't afraid.
Yeah.
So just right there, I'm telling you, it's painful. But mind you, I got vaccinated. I went on a trip. Listen. So I don't know. I just ask people to really think about it.
Absolutely. And I think that's why even though I am not vaccinated as of yet and was still processing that decision, like, this is why we have the soapbox. We want to make sure that we are not dictating to people, but we're telling them, like, hey, based upon our personal experiences, and this is why I wanted you on. This is why I wanted different perspectives on on the vaccine and COVID, so that we can have medical professionals and have these different types of conversation. Real quick, Alan, recap some of the information that we heard before we get to our moral of the story.
Well, just the recap itself is, the people that are really in it have kind of been the unsung heroes over the last year or so. I know people as well, friends of mine or older acquaintances of mine who have gone out of state to help people in more severe states. And they were, as Miss Gertie was stating, away from their family for 6 months to go help different hospitals and organizations that just didn't have the power to assist what was going on in the ground because their numbers were so crazy. And so we definitely have to salute those people who have, of course, lived their life to garner this information and are now putting it to use in the highest form And so a big shout out to all of the medical professionals, especially the Black medical professionals. Essentially, to recap, as TJ would state, they broke down how the vaccine came into existence. They broke down why they trust the vaccine. They broke down potential issues that you may have if you do not get the vaccine. And they also kind of went into the potential future of what a booster shot or an additional shot may be, as well as gave us some great tips in regards to where you can look for your information if you don't necessarily want to trust the CDC, and gave us some wonderful tips on how to scan articles for accuracy as well. So it was a lot of meat and potatoes in the pot today, and we can't thank them enough.
Appreciate it. Listen, as you guys know on Soapboxx Nation, make sure you follow us, Soapboxx Nation with 2X, Soapboxx Nation with 2X. Where's my little icon? Mr. Producer, let's get it together. Soapboxx Nation with 2X. And also, listen, we talked a lot about, and you guys know this is something that we are going to continue on this show. We talked a lot about mental health. There's the Mental Health Hotline Center. You can call it and you can text it as well. Make sure that you are taking care of your mental health. But as we all do on every week, we kind of put a bow on the conversation and do our moral of the story. What is wrong with the producer? He can't even get there. It is the moral of the story. But first, I definitely want to give a round of applause because we're going to start with her. Thank you, Holly, so much for filling in for Just Say. Thank you so much for being a guest contributor on the Soapboxx Podcast. Your official, your first time on the actual Soapboxx Podcast, and thank you for putting up with me and Bad Ty on our what we do, the Soapboxx Nation. Yes. So Holly, we're gonna start with you. Basically summarize it and also let people know where they can find you on social media. What is your moral of the story?
Basically take care of yourself, your mental health, your physical health. Get checked out. If you need to talk to somebody, there's some great resources virtually for mental health. I personally used a counselor over COVID to discuss my mental health and take care of myself. And then again, also your physical health. Do the research and do what's best for you. And if you want to find me at So Please Understand on YouTube, and So Please Understand on Instagram, and at Holly Noon on Instagram.
Appreciate you. Giovanni, what is your moral of the story?
Yes, my moral of the story, of course, is that self-love, self-care for yourself. I honestly feel like if you are really into the self-care part, you're going to make sure that you do whatever it takes to take care of yourself. So if you are not vaccinated, you will make sure that you have a primary care doctor, that you're taking vitamins on a daily basis, that you're drinking your vitamin C, you're taking those zinc pills, that elderberry, echinacea, whatever it is that you need to just stay, to keep your body in a good place to be able to fight back all of these different viruses going around right now. And then, of course, just in general, to make sure that you love yourself enough to be able to stand up for yourself and to say that you are not okay.
Appreciate you, Giovanni. Appreciate you. My man, Alan York, what's your moral of the story, sir?
Yo, moral of the story is wash your hands, mask up, treat this like a life or death situation, because, unfortunately for some people, it is a life or death situation. Additionally, I am very happy with our magic picks tonight. I'm sorry, I'm veering off. I told you earlier that we were going to make the right decision. You know what I'm saying? If you do follow me on Twitter, at Alan York, at ALLENYORK, I've been over there celebrating throughout the pod. I'm extremely happy. It's because of the hat and it's silky. But yes, outside of that, wash your hands, mask up, and just make sure to inform yourself, whether it's left or right, just make sure you are factually informed. Peace and love.
Word. And listen, my moral of the story is actually, it's not moral. I'm going to call this episode My Shop, because it's really, like I said, it's really your personal decision. Like, with all the information that I've received within the past, I guess, 2 weeks of really diving deep into the COVID-19, the vaccines, what the Delta variant is. I mean, for myself personally, I have within the last year, I am probably the healthiest that I've been in years, in a decade. Primary care physician, scanning the lungs, taking tests, doing stuff. So when the idea of a vaccine was brought up, even my primary care physician was like, "Hey, you ready to be vaccinated?" I was like, let's just wait. And so I think, if you are hesitant, I think I had a responsibility not to tell people, "Hey, go get this," but I had a responsibility to at least provide the information, even if it's something that I am personally not doing as of yet. But I wanted to make sure that you have the information so that you can make an educated decision for what is best for you and your family. And so with every decision comes consequences. And so you have to live with the consequences of your decision. And I think knowing all the information with COVID and the Delta variant, you have to understand that you are yourself taking a risk. And I think what we did tonight was a lot healthier than people who are vaccinated are just on social media, just shaming people who aren't, because I think that's also counterproductive. Like if you're someone who's doing that, you're no different than someone who's an anti-masker throwing a temper tantrum in a store when we were quarantining first. So this is really your shot. It's really about you and your body. And my stance has always been, even when it comes to abortion, I don't think government agencies should have autonomy or being able to tell people what they can and cannot do with their body. So as far as some of the federal, regulations of, hey, you can't go to, now people are making decisions, whether their livelihoods or whether or not they're going to actually get this vaccine. So morally, I'm kind of against that, but I do like healthy alternatives, like getting tested regularly if that is if your choice is to not have the vaccine. So this is bigger than you as an individual, but you have to make that decision and nobody can make it for you. So that is my moral of the story. We definitely appreciate our medical professionals that have been with us. Shout out to you, Soapboxx Nation, for sticking with us, and those who have consumed this information, not just here domestically, but foreign and abroad. So and we also want to make sure that we say get well soon to Jesse and family, and making sure that she is healthy. And we want to make sure that you are your wonderful, loud, and abrasive self that we care to love, and bubbly personality that you are here on the Soapboxx Podcast. So for Alan, for Holly, Noon, for Just Giovanni, this is TJ Legacy. Hey, get informed, make good decisions, empower yourselves. It's your shot. Let's go.
Anything. Tell them what we talking about. Anything. Tell them what we talking about. Anything.